So let's get into the first section of the law. Okay, so first let's define what do you mean by public health workers. Ang ibig sabihin ng public health workers in relation to the Magna Carta ay yung mga taong involved in health-related services. Yung nagtatrabaho sa mga areas that are involved in health-related services. Okay? So teka muna. Adjust muna natin. Okay? Services. Okay, so ibig sabihin yan, yung mga taong nagtatrabaho sa clinic, okay? Nagtatrabaho sa public hospitals, yung mga nurses, mga doctors, mga dentists na nagtatrabaho sa municipal at saka barangay health centers. Okay? So, ibig sabihin ba niyan, sir, kung involved ka sa health-related services, kasali din ba dyan yung mga janitors, yung mga administrator, yung mga auxiliary employees? Yes, kabilang din sila doon sa mga public health workers. Provided that they work or they have an employment on those public health structures or yung clinics, yung public health hospitals, yung mga barangay. So let's get into the first section of the law, which is the working conditions. Sabi ko nga, i-summarize natin based on those sections para mas maintindihan at saka easy na lang para sa atin na i-organize yung information based on the Magna Carta. Okay, so first is the working conditions. According to Magna Carta daw, guys, according talaga sa law, you need to have specific working conditions para as the law says it, to improve the abilities as well as to improve the welfare of the public health workers. Now, in relation to our study sa mga nurses, kasi sa NLE natin to binabase yung pagsa-study natin, di ba? So, according to the Magna Carta, the working conditions of the nurses should be safe and healthy. Wow! Di ba? Safe and healthy working environment or working condition. Okay, ano ibig sabihin ng working condition? Ito yung setting, okay? Setting or yung environment kung saan tayo nagtatrabaho. So when you talk about a safe environment, we are talking to an environment, we are talking to an environment that has none of the following. Okay, this is again a synthesis of the Magna Carta of Public Health Workers. Pwede mong basahin siya lahat, okay? But I would recommend to summarize this based on these classifications or based on this organization. So again, a safe working environment does not have, okay, mnemonic natin dyan is ODO. Anong ibig sabihin ng ODO? Okay, ang ibig sabihin ng ODO is understaffing. Okay, what do you mean by D? Okay, discrimination. Okay, discrimination. Okay? Ano pa? Ano yung ibig sabihin ng O? Okay? Overloading. Okay? What do you mean by overloading? This is in relation to your workload. Okay? This is in relation to your workload. Okay, again, a safe and working environment should not have, okay, understaffing. Okay, this is understaffing means na yung ratio ng nurses natin to patient is not according to the standard, ano ba, yung discrimination sa mga nurses at saka yung overloading in relation to the workload. So that is that's what it means to have a safe working environment. Now, your working condition should also have regular hours of what? Your regular hours of work. Okay, the working hours should be specified. Okay, again, rewrite natin para makita ng lahat. Okay, regular hours of work, regular hours of rest or break periods, at saka regular hours or regular days of day off. Okay, again, your work should have regular hours of work, rest, and day off. And the employees in the public health, the employees or the public health workers are entitled to training. Okay, training and development. Kasi nga, kasali doon sa goal ng Magna Carta is to improve the abilities and the skills of its constituents, di ba? So within the working conditions, kailangan ng mga nurses ng training and development. So anong form ng training and development, okay, in the form, how do you guarantee that there is training and development in the form of CPD units, okay? CPD units, gaya ng in-service training, okay? In-service training. Okay, now, so that is the working condition in relation to the public health, in relation to the Magna Carta. So what do you mean by, ano ba ibig sabihin ng in-service training? Okay, so in-service training, guys, ito yung mga training na nangyayari within the confines of the organization, kagaya ng hospital natin. Okay, ibig sabihin yan, within, sometimes nga within the scope of, okay, so within the scope of the working hours. Ang example niyan, example ng in-service training natin, okay, yung basic life support training, at saka yung training for intubation, okay. Okay, that's an example. As long as the employer or the hospital gives it within the confines of employment, or within the range, or even if within the range of your working hours, then that is considered an in-service training. So that's how the Magna Carta specify about the working conditions of public health workers. Okay, so now let's go into the next section of the law.